Good afternoon, everyone, and thank you for being here on what is an exciting day, not only for Red Deer residents, but for every Albertan who proudly calls Central Alberta home. As someone who lives in this community and loves this community, I am proud to be here and proud to be joined by several of my colleagues and partners who have been tireless advocates for improving health care in Central Alberta. Our government believes that every Albertan, regardless of where they live, should be able to access the health care services they need close to home. We know that Albertans living in the Central Alberta Health Corridor should not have to travel to Calgary or Edmonton to receive potentially life-saving cardiac care. That's why our $1.8 billion Red Deer Regional Hospital Centre redevelopment project includes 2 state-of-the-art cardiac catheterization labs. These labs will have the necessary tools and equipment to enable healthcare professionals to visualize a patient's heart and locate abnormalities. Having these services available in Red Deer will reduce wait times, eliminate the need for travel, and help patients get the care they need sooner. At the same time, having these services available in Red Deer will free up capacity in Calgary and Edmonton, improving health outcomes for Albertans living in those corridors as well. However, it is important to remember that redevelopment projects of this scale take time. And while construction has started, as you can see by all of the areas around here, the Red Deer Regional Hospital Centre redevelopment project is expected to be completed and fully commissioned by 2030. We have heard from local leadership and healthcare champions that more needs to be done to bridge the service gap for cardiac services between now and 2030. That's why I'm proud to announce our government's support of an interim cardiac catheterization lab to address the immediate cardiac needs of more than 450,000 people living in Central Alberta. This interim lab will be located within the existing Red Deer Regional Hospital Centre in a space currently being used as a physician's lounge. What makes this project even more special is that the Red Deer Health Foundation has committed to covering the capital costs, which are expected to total approximately $22 million. Recognizing that our dedicated team of physicians deserve to have quiet spaces to decompress, space will be repurposed elsewhere in the facility to ensure that they can continue to have a place to get away from the demands of the day. Preliminary design plans are already in place, and we expect the interim lab will be operational in early 2027, 3 years before the permanent labs are ready and able to support patients. Once the permanent labs are up and running, the interim cath lab space will be repurposed to provide value-added acute care service space, which is up and above the $1.8 billion redevelopment cost. The plan is for the space to become a vascular and neurology lab. So talk about a local community coming together to make a difference. We are incredibly fortunate to have the Red Deer Health Foundation advocating for the healthcare needs of Albertans who live in what I believe to be one of the most incredible parts of our great province. If passed, Budget 2025 will reflect our government's commitment of $3 million in startup funds, along with additional funds to cover the operational costs of the interim cardiac catheterization lab. I think it goes without saying that the Red Deer Regional Hospital Centre redevelopment project is one that means a lot to me, and one that I know is going to make a very huge difference in the lives of so many people. This hospital is the busiest hospital outside of Edmonton and Calgary. In fact, it has the 4th highest volume of any facility operated by Alberta Health Services. I know firsthand how caring, compassionate, and dedicated the team of healthcare professionals working here really are. And I want to thank each and every one of them for their continued tireless service to our community. Thank you so much. You're all amazing. It is my expectation and commitment that we will do what we can to ensure our healthcare professionals have the tools and support needed to deliver care and ultimately to save lives. I look forward to the construction starting on the interim cardiac catheterization lab, a project that means so much to so many, and I hope it can start very, very soon. Again, I'd like to thank the Red Deer Health Foundation for their tremendous generosity and leadership, and to our community, because we're very lucky to have you, and we're very lucky to have wonderful community leaders who I see John Donald here representing his family have something that they will be announcing shortly. So at this time, I'd like to call on Mayor Ken Johnston to say a few words.
Thank you, Minister. It isn't often when I go to a podium I have to push the microphones up. Usually I have to bring them down, but it's nice today to be able to push them up. So, Minister, thank you. And speaking of Minister, I think it behooves us to give the Minister a round of applause. This has been a challenging time in our province. Thank you, Minister, for your trip here today. I'm joined as well today by Councillor Bruce Bruma. Bruce, always good to see you. Carolyn, my wife, is here as well. Thank you always, sweetie, for the support and so on. What a day. I said back in November, and at risk of, Andrew, you only gave me 3 minutes, so I better make this good. At risk of repetition, I will say words like monumental and extraordinary and life-changing, and as many superlatives as you can add to a sentence like that, you should. Because we are approaching go time now. We are approaching the time when this dream of ours is going to come to fruition. This dream that Central Albertans will no longer be exposed to cardiac care that's outside of the zone, outside of the central zone. 500,000 people will be able to access the direct services of cardiac catheterization. I see Dr. Jim in attendance today. Dr. Jim, thank you so much for your passion. We owe him a round of applause, ladies and gentlemen. Let's give it up for the doctors and the nurses and so on. In the dying minute, Andrew, I know I'm thinking I'm overtime, but anyway. But in the dying minute, I brought a book today. On an extraordinary family, on the Donald family. And the cover tells it all. This is us. This is the story of Jack and Joan Donald and their odyssey, frankly, in central Alberta. And their odyssey when you started, Joan. I feel like I've been sitting in your kitchen this last week or so, just with a coffee pot on and the story after story after story. And I want to read just a little about it if I could. This is the remarkable true story of Jack and Joan Donald, tracing their union, family, and the evolution of their enterprise from a single service station in rural Alberta to a global powerhouse. From Jack's humble beginnings as a mechanic to Joan's careful management of the finance, their adventures unfold with warmth and resilience. Their lives are an inspirational journey of hardship and love, commitment and faith. Nose-grinding work, Joan. Nose-grinding work. Straight-up luck. Grand success. And generous giving. This is their story. I wanted to bring that today because this is a space that we should never take for granted, to be among the builders of this city and the builders of this province. I am now honored to pass the podium to Manon Theroux, our CEO of the District Health Foundation, with my thanks. Thank you very much.
If it's all right with you, I'll move these up just a little bit more. So at the Red Deer Regional Health Foundation, we're proud to be the voice of our community. We're championing change, supporting better health care, and uniting those who believe in making a difference. And we're deeply grateful for our healthcare partners who share our commitment to stronger patient care and improved healthcare outcomes right here at home. Today, we are especially honored to stand alongside our community in celebrating the extraordinary generosity of the Donald and Lacey families. Joan Donald, John and Heather Donald, Peter and Kathy Lacey, this moment belongs to you. Your historic $10 million donation is the largest in our foundation's history. It is not just a contribution. It is a transformational investment in the health and well-being of your community. With your extraordinary generosity, along with the generosity of others, the long-awaited cardiac cath lab at the Red Deer Regional Health Center is no longer just a vision, it's becoming a reality. And you might wonder why we're in this odd space in this building. First, we're under construction, so there's nowhere else to go. Secondly, if you look out these windows, that is where the interim cath lab location will be, so we wanted to have a bit of a glimpse of where it'll be. So for too long, Central Albertans have faced an unacceptable and heartbreaking truth. When a heart attack strikes in Red Deer, the critical, time-sensitive care that they need is often hours away from Calgary and Edmonton. So minutes matter in a cardiac emergency, and that's the distance, and that distance has made a difference for far too many. But because of you, that changes. So your generosity is more than a dollar figure. It's a lifeline. It's a contribution towards fewer families being forced to wait in the fear of an emergency transfer. It means more loved ones will return home safely. And it means that an estimated 160 lives will be saved. And countless others will receive the urgent specialized care right here at home. This gift of magnitude does not happen by chance. It takes vision, leadership, and an unwavering commitment to the people here in Central Alberta. So Joan, John, Heather, Peter, and Kathy, you are the embodiment of what it means to give selflessly, to invest in the well-being of our community, and to lead by example. Your generosity sets a new standard for what's possible, inspiring others to follow your footsteps. So while today we celebrate the incredible legacy you are building, this moment is also a powerful reminder that philanthropy and teamwork is the driving force behind progress. It's the belief that our community deserves better, backed by the action to make it happen. And because of you, we are witnessing real-life progress unfold before our eyes. So on behalf of the Red Deer Regional Health Foundation, all our healthcare and government leaders, and thousands of patients and families whose lives will be touched by your generosity, thank you. Your impact will be felt for generations to come, and in every life saved, in every family kept whole, as you would say, and in every heartbeat that continues because of your unwavering support. Thank you.
Oh, there's a lot of cameras. So first of all, I got to apologize for my voice. 2 days ago, I couldn't speak. Made my wife happy, but I'm back. I'm back, baby. Good afternoon. Today, I'm honored to be speaking on behalf of my mother, Joan Donald, my wife, Heather, and I, and Kathy and Peter Lacey. So when I sat down to write this speech, it was hard to put into words what today means to our family. But on reflection, what I can say is it took a long time to get here. 16 years ago, I was the chair of the hospital foundation, and I sat in on a presentation from a cardiologist, Dr. Nagarita, which I don't think is here. Dr. Nagarita laid out the hard truth that too many people were dying of heart attacks at a much higher rate than communities with a cath lab. Not a small percentage, 200%. Let that soak in. It's unacceptable. Just the facility rate was also the outcomes that were not as good. So, in addition to the death rate, we have outcomes that when you do get your stint in Calgary or Edmonton, and you get sent back to rehab, or you get sent back to Red Deer, you tie up a bed for a long time and you go to rehab. But the outcomes were not nearly as good, and that's because minutes matter. I was going to use seconds, but I think Stars Air Ambulance uses that one. In Central Alberta, we simply could not get the cath lab care in time. Last year, we lost my father, Jack Donald, to heart failure. Well, his story was different and reinforced something I already knew. When it came to heart care, minutes count. And Central Alberta has been waiting way too long. We have an opportunity today to save lives. That's a big thing. For today, we can make better outcomes. Our families have decided to take a stand and lead by example, because this one matters. Again, this is about lives, better outcomes, families, keeping loved ones together, reduced bed times, reduced ambulance use, reduced rehab times, reduced imaging costs, and there are many more reasons, but you get the picture. I consider it a privilege to be able to start off this campaign with our $10 million donation. I would like to thank a few people. Dr. Jim, you've been an advocate for this hospital for the same 16 years that I've been pedaling uphill, seems like. So thank you. I would like to thank the foundation, the board, Manoa and her staff, Manoa and her staff. And most of all, I would like to thank Adriana LaGrange, our health minister. Mr. LaGrange, I got the opportunity, and I was told to keep it positive, so I said opportunity, to work with 6 different health ministers in those 16 years. And to get where we got today, it just took one Adriana. Government got it done. We can see the finish line. All we have to do is raise the rest of the money, which I believe, when you're talking about lives, should be something that should be easy to get done. In closing, I can only say, let's get it done. Thank you.
Good afternoon, everyone. My name is Janice Stewart, and I am the Chief Zone Officer for the Central Zone for Alberta Health Services. It's my pleasure to be here on behalf of our leadership and all of the staff, especially the staff here at, pull it down. Especially the staff here at Red Deer Regional Hospital. I would like to begin by thanking the Government of Alberta for this recent commitment of funding. With this confirmation of financial support, we can move forward with confidence in providing cardiac catheterization care to patients sooner and closer to home. I'd also like to express my appreciation to the Red Deer Regional Health Foundation for its unwavering support. Through its relationship building and advocacy, the foundation continually connects giving individuals like the Donalds to our vital health needs here in the zone. And this results in tangible and direct impacts to our patients and our families. And most importantly, I would like to express my gratitude to our donors, John Donald and his mother, thank you, and all of his extended family. Thank you for this very generous gift and commitment to the health and well-being of Central Alberta. For those who may not know, a cardiac cath lab is a dedicated space with skilled teams that use diagnostic tests to examine and evaluate the heart's function. Cardiologists, trained nurses, and technicians all work together as a team to provide specialized procedures that treat various heart diseases, including opening blocked vessels and treating irregular heart rhythms. Preliminary plans are in place, as Minister LaGrange has said, to construct this lab in the repurposed space on the main floor, which you'll be able to see down here out of the windows, and within the next 2 years, which is much sooner than what we could deliver it in the overall build. The Donald family has been an important legacy in central Alberta, and with the support provided in a number of significant and impactful ways across the region. It's no exaggeration when I say that this interim cath lab will be life-saving. I started my career as a cardiac nurse, and I can tell you that there will be many lives saved here in the near future. In the cardiac community, we have a saying, time is muscle, and you've heard that. Minutes count, hours count. And it simply means that every minute that we save are minutes saved in saving muscle. And saving muscle saves lives. And so having direct access to a cath lab for this community will absolutely save lives. And so I thank the Donald family for being leaders in our community and for identifying the vital impact that this contribution has in the health, the wellness, and the lives of area residents. We are fortunate and grateful, and we want to thank you for being a part of our healthcare family. Speaking of our healthcare family, I'd like to acknowledge the skill and compassion of our physicians and our staff who make exemplary patient care possible every day. We believe a lab such as this will help to attract and retain personnel that we need to add to our already talented teams, and we will work to make that so. With partners such as government, the foundation, our teams, and the Donalds, we know we can work together to enhance the care for all Central Albertans for many years to come. So thank you very much.
Everyone. We'll open it up to questions from the media. As always, if you could please state your name and outlet, and we will be sticking to one question, one follow-up today. We do have a mic at the front of the room for any reporters with us today.
Hi, Jasmine King, Global Edmonton. This might be a question for the mayor, but maybe someone else can speak to this. We heard about the government support, but this really sounds like, so much of the community, this was really a community-built project. Just what does that really mean to you to see everyone who came together as the donors and just everyone really rallying around this?
Well, maybe I'll start by saying the government's involvement is we're putting $3 million at start off, but we're also financing it all. And the fact is that with the $1.8 billion redevelopment, we're also providing the operational dollars on top of that. So this adds to the $1.8 billion, but certainly much needed. And I'll turn it over to the mayor to add on top of that.
Thank you, Jasmine. It's a wonderful invitation to talk about that. It was on this date, for sake of the day, it was on this date in 2017 that Dr. Jim and his colleagues called a town hall meeting together at the Baymont, and the community turned out in incredible numbers. In fact, they booked one meeting and they had to carry it over to two because the turnout was so great. So this is an amenity that the community has waited a long time for. The fuse was lit by people like John and Jack Donald and Joan in particular back in the day. I think, John, you talked about, sort of a slow movement uphill. It took some time, took some momentum to do that. Our own family was personally affected by the entire shortage of cardiac here in the city. So words, as I described, as monumental and transformational and so on, they really don't adequately describe what this gift means to us here. The generosity expressed by the Donald family is always staggering and very humbling. So this, again, Central Alberta benefits. Alberta will benefit. Western Canada will benefit because the vision for the hospital itself will be a medical center of excellence. And today we saw, the tangible grassroots along that. Thank you for that question.
And then just for a follow-up question, obviously we're still a little bit away now, but just what is the staffing going to look like and how are we going to see that staff coming in here?
Thank you for your question. So we've already started to look at recruitment for staff, and we have a two-pronged approach. One is to recruit people who have existing training and would like to relocate, and the other is to support some of our existing staff who wish to make a slight career advancement or change, and to support their education with the help of our larger centers. We've already developed a relationship with both the Calgary and Edmonton cardiac programs, and they have agreed to help us both with our staff and physician recruitment and training for that.
Hi, Ashley, RD News Now. Thank you. Minister LaGrange, could you just speak a little bit on how will this facility change the makeup of healthcare access in Central Alberta?
The overall $1.8 billion redevelopment is actually the largest in Alberta history in terms of a project. Even the new cancer center that was just opened recently was only $1.4 billion. So this is huge. We know here in Central Alberta, I've been here since 1981, but my husband's family, my husband was born and raised here. His family's been here since 1942. We know that we've been under resourced in Red Deer, if I could put it that way, for a very long time. Everyone here knows that, and so this redevelopment is transformational, as the mayor indicated earlier. It is going to be a center of excellence. It will be a place that people will be proud to work at, and we will make sure that it has the resources and supports it needs. Now, in terms of the cardiac catheterization, there will be 2 permanent labs when it's fully developed, but in the interim, we need services, and we need them now. So this, again, this fantastic, monumental, I'll use your word, Mayor, monumental donation by the Donald family, who always step up and are just salt-of-the-earth people. Can't say enough good things about them, that it helps spearhead having those services earlier, because I don't think there is a person in Central Alberta that doesn't know somebody who's had a heart attack or who has suffered some sort of a cardiac issue that has had to go out of city to be dealt with. And again, minutes matter. So this is huge, really huge. And as you can see by all the construction going on, it's happening. I remember the first number of years when I was the MLA in 2019 all the way to 2023, and they kept telling me it's not going to happen. I was like, yes, it is. It's going to happen. We're going to make sure it happens.
Excellent. Thank you for that, Minister LaGrange. And then just to kind of follow up, as we've heard, this is a very exciting community announcement, but as it's kind of been alluded to today, it is coming at kind of a difficult time. If we could just speak to, there have been repeated calls from opposition for yourself and the Premier to step down while there's an active investigation into contract procurement claims. Just as an MLA for Red Deer, what would you like to say to your constituents in response to that?
Well, just what I've been saying all along, that the allegations where they pertain to me are false, and I look forward to them being defended very vigorously in the statement of defense that will be coming out very shortly. I have always been a servant leader in all of the things that I've done long before I became an MLA, long before I was a school board trustee, as a mother of 7, as an active person of faith who was involved in my church and in my community and in so many different boards and committees, et cetera, that I've been on. It has been a huge honor for me to serve the people of Central Alberta, Red Deer North in particular, and I value the trust that the Premier has put in me to get the refocusing done. The refocusing is really about the largest transformation of Alberta healthcare that has taken place in decades, if not longer, and it needs to be done because Albertans deserve excellent healthcare. That is my only goal. That continues to be my only goal, and I'll keep working until that job is done.
Thanks, Minister. I'll do one more call for media in the room. I don't see anyone, so we'll go to the phones. Operator, can you put through our first caller, please?
Your first question is from Terry Fikowski from CTV News Calgary. Please go ahead.
Hello, my question's for the Minister. Thanks for taking it. Calgary Law Suite MLA Eric Bouchard and his constituency office is hosting a second injection of Truth Town Hall tonight and is calling for the province to implement recommendations of its COVID-19 task force report. Now that you have had time to review that report, I'm wondering if any recommendations will be implemented, particularly around suspending vaccines for children and pregnant women.
We're continuing to look at that report. As we've always indicated, Alberta and Alberta's government always wants to look at all sides of an issue, and so the fact that people feel passionately about one side or another of an issue continues to be out there, and we'll continue to look at the report, and we will base any decisions that we make. No decisions have been made as of yet, but we'll base those decisions on evidence.
My follow-up would be that the association says that 10 UCP constituency associations support the event. Unclear if it's MLAs as well, and that's for things like the suspension of vaccines for children and pregnant women. You know, as health minister, are you concerned that events like this one, which do just include, contrarian voices, if you will, are contributing to growing misinformation about vaccines and seeing things like the measles outbreak we're seeing south of the border and even in Canada?
Well, vaccine hesitancy is not just an Alberta phenomenon. If you look right across the stats, right across all of Canada, North America, and globally, vaccine hesitancy is out there. And so we continue to promote the fact that we have vaccines that have been proven, whether it's measles, rubella, the chickenpox, and polio, etc. Obviously, we are seeing a resurgence of polio because of vaccine hesitancy in certain locations and sometimes the lack of access to vaccines. So we will continue to look at evidence as it comes forward, not just locally in Alberta, but also global evidence. And we will continue to make sure that parents are armed with the information, that parents and guardians, they're the ones that need the information, and they need to make the best decisions for their families and themselves.
Thanks, Terry. Operator, next caller, please.
Just for clarity, is that a yes? Are you concerned that these 10 constituency associations support the opposite of what you're just saying?
I believe that what is being discussed is around COVID, not necessarily all vaccines. Therefore, we're going to make evidence-based decisions, and parents armed with good data can make the best decisions for themselves and their families.
One question, one follow-up today. Operator, next caller, please.
Your next from Jennifer Lee from CBC News. Please go ahead.
Hi, thanks for taking my question. This is for the minister as well. Minister, I'm wondering how you respond to concerns, from a number of groups, including the Alberta Medical Association, for example, and others that are raising concerns that your government's budget allocation for health spending isn't keeping up with, for example, population growth and demand, and really that not enough funding is being allocated to addressing the pressures on the front lines in terms of recruiting and retaining staff and that sort of thing.
Well, it is a tough budget all around. Certainly, we have some looming issues that we may be contending with, particularly the tariffs. There's a number of other factors that will probably play into our budget. But that being said, I'm very pleased that the recognition by our government that education and healthcare are priorities in this province. And so I was very fortunate to see a 5.3% increase overall in healthcare spending. It really does look at making sure that we are resourcing our healthcare system to meet the demands that we have. When I look at the fact that our physician compensation budget alone is just going to be shy of $7 billion, that is the highest it's ever been. in Alberta's history. We want to make sure that we have the resources to fund the new primary care compensation model, the medical resident compensation that we were able to negotiate recently as well, et cetera, et cetera. We are in, as you well know, we are in contract negotiations with all of our healthcare unions, and we want to make sure that we're resourcing appropriately.
I will note that the Alberta Medical Association is arguing that physician compensation and development falls about $600 million short, I think, of what they think is needed. So I'd like you to comment on that. But then further to that, when it comes to administration spending, that's going up, $544 million this year, $604 million by 2027-28. So does this include the cost of restructuring the health system, and how much is that price tag? And how do you see that increase in administration spending corresponding to your government's messaging dating back several years that AHS was essentially too top-heavy?
So your first question in terms of the doctor's compensation, again, there's a huge increase from the previous year. I believe we were at $6.2 billion. We're now closer to $7 billion. We have just landed on an agreement with the primary care compensation model that will make sure that we have family physicians and rural generalist doctors right across the province. We want to make sure that every Albertan has access to a primary care home, to a primary care practitioner, and we are following that up with the resources to make sure that those doctors are properly compensated for that great work that they do. We will continue to work with the AMA to make sure that we're addressing the issues, but we also need to make sure that we are sustainable in the province. As I said, close to a $7 billion overall envelope for physician compensation would make it probably the third largest, if not the fourth largest budget line item if it was an actual ministry within government. So I think that's a huge commitment, and we're continuing to work with them. In terms of the administration costs, there have been no new administration. It is really just they're going into being pulled out of Alberta Health Services, going into other areas. But we are continuing to work to make sure that we do streamline our levels of administration across all departments, and particularly within the Ministry of Health, because we need to make sure that the most critical people are the people on the front lines. And I don't want to diminish the work that is done behind the scenes. We need to make sure that that work happens as well. But we also have to make sure that there's easy access from the bottom, front lines, all the way to the top, and make sure that that is a direct line of sight pathway in terms of administration. So we're going to keep looking at how we can make things much more efficient and redirect resources to the front lines.
Thanks, Jen. For sake of time, we're going to move to our final question. Operator, can you put through our last caller, please?
The next question is from Carly Robinson from City News. Please go ahead.
Hi there. This question is for the minister. It's about emergency medicine here in Edmonton. We're seeing pictures of mass casualty incident stretchers being dropped off at ERs in the Edmonton area to try and free up EMS. Can you comment on the use of these mass casualty incident stretchers?
Well, my understanding is that there were some, I'm just grabbing some numbers here, that overall we're seeing progress in the Edmonton area. My understanding was that there was some data that was shared recently through a FOIP that was not actually interpreted correctly. But that being said, I know that we are continuing as a province to make sure that we get our EMS, our paramedics out as quickly as possible, and that when they go to the hospital that they have a quick turnaround. That's going to continue. In the Edmonton area, the progress that I'm seeing, at least what's being shared with me, is that response times are at the 90th percentile in January 2025. That was 15 minutes down from the peak of 18 minutes in November of 2022. That being said, we have to get better. And it's why we're investing in making sure that we're adding more healthcare EMS professionals across the province. We're also looking at training more, and we're also looking at making sure we can put more ambulances on the road, because that'll make the biggest difference.
But Minister, what message do you have if these mass casualty stretchers are needed to be used? What message do you have to the patient who's needing to use them? Because typically mass casualty is an extreme measure.
Well, we have a very well-formulated EMS system that has they are able to evaluate the needs that are there, and then they bring forward recommendations to government. It is the reason why there's been a task force that's been tasked with looking at EMS, and particularly looking at our rotary, our helicopter, as well as fixed-wing EMS. We're looking at all of it. I expect a report by the end of March, and if there's recommendations that we need to do things differently and address change, we will be doing that as quickly as possible.
That was our last question, so that ends today's news conference. Thank you, everyone.